Cannabis is an essential part of any nurse's toolbox, yet there are still significant barriers in access to science-based education. There are countless patients in need of nurses able to openly educate on cannabis as a medicine. Sometimes the patient stuck behind that barrier is the nurse themselves. Hi, I'm Gloria. I've been most of my life in emergency medicine. I'm a proud New Jersey Shore resident. I was an EMT for a long time and then an RN. As a nurse, I spent years working with a neurologist who specialized in multiple sclerosis, which is where I learned about cannabis. So if you're not aware, multiple sclerosis patients use cannabis very successfully, especially for treatment of neuropathy. So we would work with our patients when gabapentin would fail. And I remember octogenarians saying how amazing it was. And I particularly remember one woman who said, after she had gotten her first restful night of sleep without nerve pain, saying, "I forgot that I deserved to feel this good," which was pretty hard to hear, but happy that I was able to help her. So after seeing the success that the MS patients had, I wanted to learn more. So how do we properly arm ourselves? We're nurses, we know how. We stay current and we stay up to date. Like, did you know that cannabinoids are being researched with their effect in PTSD? Now, what about COVID? I'm sure you all have heard about CBD and COVID. Well, research is looking at how CBD interrupts the impaired endothelial cell function that's responsible for the acute respiratory distress syndrome, or ARDS, and the hypercoagulable state that COVID-19 causes and wreaks havoc through the patient's body. So this is really interesting stuff that we should pay attention to. Now, medicinal programs are growing. There's currently 37 states that have medicinal marijuana programs, and that's changing all the time. The longer you work as a nurse, the more likely you'll be to come across somebody who uses cannabis, whether it's medicinally or recreationally. So what are you gonna do when your patient comes to you and wants information about cannabis? We access our toolbox. We have a lot of tools. We need access to them at all times. With cannabis, it makes it a little bit difficult. Blocked access on computers, on our cows, I said it, is big deterrent to getting good information to us and then to our patients. That IT block, it kills us. And I hope that nobody's out there searching weed, but even cannabis, marijuana, those words are even blocked and they don't let us get to the information that we need. When we have to go around blocks, we end up finding information from unprofessional sources. And of course, continuing education. So we're saying things are changing and we need to make sure we stay current. So our facilities need to offer the opportunity for continuing education. Does your facility provide you these basic tools to take care of your patients? So does your EMR list marijuana as medicine? If so, it needs to list a couple of things. It needs to list therapeutic use, dosage, interactions. And we know the reasons why those are important to list so that we can look at a patient's entire med list and consider everything that they're taking. If it doesn't list marijuana as a medication in your EMR, let's try to use some science to help us, okay? So my job, and probably yours, loves to quote Medicare and say 20% of all readmissions are due to medication errors, and 70% of those are avoidable. So if they're gonna throw that at us about getting accurate information about medicine and medication lists, then we need to be able to access all of the information for the patient. Some hospitals have committees too, where nurse practice committees come together to help make changes to EMRs. So that's another way that you can make this happen. But thankfully, nurses are resourceful, and we've put together some things nationally to start to help the process. So you need to align yourself with these national standards. National Council of State Boards of Nursing put out a guideline for nursing care for patients using medical marijuana. There's information in there about nursing care, including having a knowledge of your state's medical marijuana program, having some knowledge about ECS, adverse effects of cannabis. So it's a good place to get started if your facility doesn't have the information that it needs. Now, finally, we need to align with like-minded nurses. You found the Cannabis Nurses Network. I'm glad that you're here. We support each other professionally and personally, which is helpful because we all know that we need the support today more than ever in our profession in this post-pandemic world. So now the serious question: why, as nurses, is our health secondary to the ones that we take care of? We know we're deserving. Our careers are littered with moments of violence, of abuse, unstaffed staffing ratios, unrelenting shifts with no breaks. I could go on. You all know, and you're all experiencing it. So if we know all of this, why is it so hard to be the patient? One of the reasons is that with cannabis use for nurses, the consequences can be extremely severe. They can healthcare hero you all they want, but at the end of the day, if your drug test came back positive, they'd let you go. We're supposed to take care of the sick, but we're not allowed to be sick ourselves. Because if we continue to ignore it, the results could be catastrophic. Unresolved trauma, mental health issues with no support, the need to hide illnesses. There are so many nurses out there, myself included, that on their tours of duty with COVID, their problems are only appearing now in nightmares. And if it wasn't for cannabis, I wouldn't be here. And I think that there are many others who can unfortunately identify with that. Just the other day, a nurse committed suicide because of it. One is too many. Another statistic is that 1 in 10 healthcare workers in Australia have considered suicide or self-harm post-pandemic. 1 in 10. So things have been serious and they're getting more serious. And it's time that we take our own health into our own hands. Now, I'm not coming from a place of healed, but I'm coming from a place of healing. And I want to give that as a gift to everybody else because I have cannabis and the people that I've met through the Cannabis Nurses Network to thank for it, because it's helping me through my darkest days. So now it's time to grab your allies. Science. Science is your ally. We live in an evidence-based profession. Excerpt from a journal article that I had used in a recent job interview. I had failed a drug test for a non-bedside job, and I couldn't understand why, because I had a valid medical card and I wasn't going to be touching patients. In fact, I was over the phone. I struggled, panicked, and then I did my research. So let's read this first line together. There's no reliable method for determining the time that individual last smoked marijuana by analyzing urine. That's all I needed to say. This proves that a urine drug test has no weight, and I just had to look for it. Submitted this article, never heard another word. Now, community is your ally, just like we said before. Community is everything, and especially in our profession where we need the personal and professional support. If you didn't know this before, you will now. So join these communities and stay current. I'm going to take that education back to my job and I'm going to present it to people. And I'm going to keep this narrative going. I'm going to discuss new studies and new opportunities with my job, and I'm going to keep this conversation going. And that's what we all need to support each other doing. So remember, nurses are the worst patients, but we have great backup support in our profession with science. It's rooted in science. Science is always changing, but evidence-based practice will always save us in the end. Where we are today is nowhere near where we were a year ago, and it'll be completely different in another year. So we have to stay the course. We have to do the research. We have to show up and speak up, and we have to support each other. Cannabis is the medicine that we all deserve, especially nurses.